Good afternoon, everyone, and welcome to our third webinar of 2020, DOT Regulations and Sleep Apnea. Before I introduce our presenter, I would just like to remind everyone that if you missed our previous webinars earlier this year, you can find them on our website, Precision Sleep Solutions. We've covered some interesting topics, including a presentation on sleep apnea by Dr. Berger, and CPAP masks and mask issues presented by Susie Justice from ResMed. In addition to the webinars, we have so much interesting information on the website, so please go pay us a visit. Today we welcome Wendy Sullivan, who will be presenting one of our most frequently asked about topics, DOT and sleep apnea. Wendy has been a registered nurse for nearly 45 years. Her most recent employment starting in 2000 was at Schneider National, first as an occupational health nurse and then manager of the occupational health team. While there, she realized a trend with all the drivers she and her team were working with, many of whom had sleep apnea or needed to be screened and tested for it to rule it out. In her routine meetings with both the health and safety teams at Schneider, it was identified that the untreated sleep apnea was affecting healthcare costs and fatigue-related accidents, and set about to help Schneider improve the situation. She first met with a team of drivers for their input into what they would need from their perspective. Quick turnaround time and support if they were indeed diagnosed came to the forefront. After leaving Schneider in 2007, Wendy worked with Dr. Mark Berger, a doctor boarded in sleep medicine, to develop the program that would meet the needs of drivers. It became and continues to be her passion today. Wendy is a board member at Precision Sleep Solutions and serves as liaison between PSS and the carriers that we service. Apart from playing a vital role in the world of sleep apnea and truck drivers' lives, she's just a fun-loving and wonderful person who cares about the health of truck drivers. Because sleep apnea and truck drivers are at the epicenter of Wendy's life, her grandchildren think that Wendy sleeps with truck drivers. It doesn't get better than that, folks. Without further ado, I present to you Wendy Sullivan.
Thank you so much, Katya, and welcome to all of the drivers that are here with us this evening. It is my pleasure to review frequently asked questions concerning the DOT regulations as it relates to sleep apnea. So what we're going to cover today is actually what regulations do apply to this space. We're going to talk a little bit about who actually uses them. We're going to review a DOT examiner example and have a little fun with that. We're going to review what DOT examiners actually look for when they're assessing a driver for sleep apnea. We're going to go over some myths that are out there concerning this particular diagnosis. And we're also going to talk a little bit about compliance requirements at the DOT examiner level. So without further ado, I am going to have you go to the next slide, Katya, and I'm going to start with a very basic regulation, which has to do with the general applicability of the federal medical regulations. So starting out the chapter of all the particular DOT medical regulations that are on the books, there is one that basically, in a nutshell, is kind of self-explanatory. It starts out with, there is nothing in this chapter or subchapter that shall be construed to prohibit an employer from requiring and enforcing more stringent requirements relating to safety of operation and employee safety and health. Next slide. The issue is that carriers are allowed to implement their own safety and health programs as long as they do not go below the required medical regulations required by the Federal Motor Carrier Safety Regulation Handbook. So they can go over and above. And you think, well, why can they do that? Well, the liability rests with them. Doesn't rest with the Federal Motor Carrier Safety Administration. Precision Sleep Solutions has worked with carriers across the country that have had safety sleep apnea programs in place now for at least 14 years. So it has legally really stood the test of time. Next slide, please. The other regulation that is probably the most pertinent to this particular situation is Regulation 391.41B5, Physical Qualifications for Driver. In this particular one, number 5, a driver may operate a commercial motor vehicle if the driver has no established medical history or clinical diagnosis of a respiratory dysfunction likely to interfere with his or her ability to control and drive a commercial motor vehicle safely. Next slide, please. Well, here's the thing. Sleep apnea is a respiratory condition that occurs during sleep, as breathing is interrupted. So it falls under the respiratory regulation that DOT examiners utilize today. I'll often hear from drivers, well, there is no specific regulation about sleep apnea. True, but the respiratory regulation applies to this medical condition. Just like if there was a blanket regulation about heart disease, putting a stent in might be applicable to that diagnosis. Attorneys use this regulation as well in any court cases they are involved in relative to driver accidents. So of course, prevention is the best policy for all concerned. Next slide, please. Regulation 392.3, ill or fatigued driver. This was a regulation that I became more familiar with when I was actually deposed in a court case. And this reads, no driver shall operate a commercial motor vehicle, and a motor carrier shall not require or permit a driver to operate a commercial motor vehicle while the driver's ability or alertness is so impaired or so likely to become impaired through fatigue, illness, or any other cause, and that would make it unsafe for him or her to continue to operate that commercial motor vehicle, which, let's all remember, is an 80,000-pound vehicle, very difficult to stop quickly. Then the rest of this paragraph goes on to, it modifies this a little bit simply to speak to a driver can basically drive to the nearest place where the hazard would be removed from the highway. So goodness sakes, you know, he has a chance to get out of traffic, you know, putting it simply, as long as everybody remains safe as a result of that. Next slide, please. So safety being the utmost importance to the trucking carriers and those on our nation's highways, it is also of utmost importance to a driver's ability to remain operational and provide for his or her family. Not unlike you or I. We don't want to be taken out of a day's work if we don't have to be. The DOT medical regulations speak to those medical conditions that would put either at risk, and why the Federal Motor Carrier Safety Administration does DOT medical exams routinely because of the inherent risk of that large vehicle and being within the motoring public. So let's talk a little bit about an interesting DOT examiner I got on the next slide. This DOT exam was actually done on August 3rd of this year. There was a letter from the DOT examiner to the clinician that indicated the following. Number 1, the driver was giving a pending determination that expires in 45 days to obtain a sleep study. What we at PSS, and I used to see quite a bit in my years at Schneider, was also these drivers get a 3-month card in an effort to find the time to get what they need to get done for a sleep study. Number 2, age. This particular driver was 42 years of age. He had a BMI greater than 33. He had a Malampati class 3 or 4, which is the measurement of the opening in the back of the throat. So basically the DOT examiners just have to say, have the driver say, and take a look, and they can tell if that airway is crowded a little bit. And a neck size greater or equal to 17 inches, because the more, excess tissue around that neck, the more potential for closure of that airway. So a sleep test was required by the DOT examiner to rule out sleep apnea. What was interesting is on that paperwork that came over to me, the respiratory regulation I cited earlier was actually printed on the paperwork to the driver to get tested. So an example of a DOT examiner using that very regulation to encourage this driver, or force this driver in this case, to be tested to rule out sleep apnea. Next slide, please. So basically, what do the DOT examiners look for? While individual examiners make the assessment as to whether or not a sleep study is needed, we actually just saw a sneak preview of what one examiner looked for in order to make the determination. Height and weight, which is the body mass index, age, neck size, and measurement of the opening in the back of the throat. These are very common examiner assessment tools. Next slide, please. Some other things that may be considered, and certainly for those drivers that have previously been screened via a screening tool, men or women, there's a difference. Women are not at risk so much until they actually hit the menopausal stage of their life. But this is critical, and this is one of the things that flagged me, number 2 on this slide, to do further investigation while I worked at Schneider and with the drivers. There are other medical conditions that are often present that could also indicate untreated sleep apnea, and I saw this a lot. Diabetes, high blood pressure, heart disease, irregular heartbeat disorders, histories of strokes or TIAs, which are like passing incapacity from a stroke, like symptoms, a family history of sleep apnea. Carriers or examiners that utilize screening tools, like I mentioned previously, to determine who is most at risk to test positive, often include considerations such as previously mentioned. There's no reason, no need to test everyone, but we need to screen everyone to determine who may benefit from testing to rule sleep apnea in or out. Just like you would if I was complaining of chest pain and I go to a physician, they're in that physician's mind, they may think, well, she could be having a heart attack. She could have potentially injured her rib. She could have some sort of lung infection. But until I'm actually tested and ruled out, the diagnosis is not yet confirmed. So the previous example by a TOD examiner that I gave you, question, did the driver test positive or negative? What is your guess? Next slide, Katya. The driver tested negative for sleep apnea. And the reason that I included this example in this particular presentation is because one of the myths that I'm going to talk about on the next screen, Katya, is those of us at PSS understand, first of all, the stress of a new medical diagnosis and often the fear that accompanies it. But what is myth and not fact? As you just experienced, a driver with several risk factors screened positive, hands-on screened positive, and actually tested negative. About 28 to 32% of any truck driving fleet is at risk for a positive sleep apnea diagnosis. Not 100%, about a third. Of those that are screened at high risk, only about 85, 88 depends, will test positive, and around 15% will test negative, as was the case with our previous driver. And this driver had a face-to-face with the DOT examiner. It is why the actual study is so important to rule it in or rule it out. Next slide, please. So let's talk a little bit about what happens after you test positive. You're going through treatment. What is the DOT examiner looking for? What are carriers using as their standard in order to determine whether or not you are compliant with your CPAP therapy? Currently, the carriers and the DOT examiners are using some Medicare criteria. Medicare is loaded with sleep apnea. They're 65 and older, right? And it is also a disorder of increasing age. So they have a lot of sleep apneic patients in the Medicare population. And it indicates that a driver needs to use a CPAP machine 4 hours a night during 70% of the nights in any given date range. Here's my opinion. If you use your CPAP machine every time you sleep or nap, you should have absolutely no problem meeting those expectations, obviously, once you're acclimated to therapy. I am a CPAP user myself this past year, as is my oldest son, and I suspect son number 2 and eventually number 3. There's a definitive family history. And so I've been on the lookout for that in myself and my children. We have 100% compliance, and I can tell you we feel the improved effects of same. The spouse of one of my children came to me with her concerns about, as a bed partner, of what she was seeing and hearing. So we are experiencing better quality sleep, no morning headaches, the snoring has gone, they're more alert during the day, I'm more alert during the day, there's less anxiety and depression, and certainly any medical conditions that would have accompanied the diagnosis, we have also seen improvement. Next slide, please. Right now at the federal level, and we've got DOT examiners all over the country with all different kinds of medical backgrounds and qualifications. There is not particular guidance at this time for a DOT examiner. However, most DOT examiners are looking for 90 days or more to get a good idea of the driver's CPAP use over time. If you understand, they are putting their name on your medical card as safe to drive for another year based on their best indications. So some examiners may ask for less, some may ask for more. I particularly enjoy looking back on a year. I think for seasons, you know, too cold in the truck, too hot in the truck. Maybe you're on the road 3 weeks, maybe you're on the road 2 days. You feel differently in those circumstances. So it's kind of a good benchmark for how you're doing overall. If you try to manage to only 4 hours a night, I'm going to just tell you that's not enough sleep for anyone. Whether you have sleep apnea or don't have sleep apnea, you should not be trying to sustain yourself on 4 hours of sleep and then put in a productive workday. Our clinicians will work with you on important topics such as mask fitting, sleep hygiene issues. It's not just about your disordered breathing. Are you watching TV too soon before you put that mask on? Is the room dark? Is the temperature right? How much caffeine have you had? How much eating have you done prior to going to sleep? And not to mention some of the anxiety, especially around the newer diagnosis until you become comfortable with the device. It's like anything else. If I gave a diabetic that was insulin dependent a needle with insulin and said, here, start injecting yourself without somebody to hold, no nurse or clinician to hold their hand during that process, of course it's going to be more uncomfortable. And this is why earlier I mentioned the driver's request was somebody help me through this, which is what PSS is all about. And just like any new medical diagnosis, sinus infection, maybe my doctor tries me on amoxicillin for 7 days. It doesn't work. The symptoms are still there. They may switch me to something else until it does work. A few things may need to be tried first to get you therapeutically treated. In other words, get your numbers where they need to be, but also to get you comfortable. And that takes some practice, and our clinicians have a wealth of information to help in that space. And the cool thing is PSS will also provide a really cool DOT compliance letter for you to take to your examiner for your next exam. Keep in mind that the DOT examiners, at least most of them, want that AHI below 10. So if they're, you know, if you're hovering at 12 on therapy or 13 on therapy, that's something our clinicians will also watch for to make you sure that we set you up for success when you actually get to that DOT examiner, because they're not just looking at the 4 and 70, they do take a little bit of a peek at that AHI as well. So with that, I'm going to open it up to the drivers for questions. If there are none, then we will certainly be, as Katya indicated earlier, we will be placing this on our website for review. It's just good, helpful information as drivers talk to drivers and spouses talk to drivers and so on and so forth. So I hope you found this beneficial. So with no additional questions, I thank you for attending and look forward to talking to you in the future.
Thank you so much, Wendy. I can't think of a more important topic to talk about right now, especially in light of sleep apnea being linked to so many other conditions. I think the latest podcast I was listening to linked it to dementia. So the importance of sleep in our life, good quality sleep, and like you said, 4 hours isn't enough. It just adds so much benefit to our life, and I appreciate you and thank you so much.
You're most welcome.
To our drivers and anybody else listening, if you wish to speak with Wendy or contact our office, please call us. You can reply to the invite webinar you received from us, or you can reach us through our website. And also stay tuned. We have some other interesting webinars on our horizon. I believe the next one's going to address erectile dysfunction and sleep apnea. And we're also going to hopefully try and invite some spouses and partners or family members to a discussion on sleep apnea and answer any questions or concerns, fears that they might have. So
Right.
thank you, everybody. And we hope to hear from you or see you on our next webinar.
Good night.